Hello guys, how are you? This is Amir Ghawas, fourth semester. I'm in university, Bishkek, Kyrgyzstan. Today the topic of my presentation is drugs affecting on thyroid gland. I'm gonna throw light briefly upon those drugs which can affect the thyroid gland. I would like to briefly explain the thyroid gland and the structures which are present inside thyroid gland. So let's start the thyroid gland. The thyroid gland is a vital gland. It plays a major role in the metabolism, growth, and development of the human body. It helps to regulate many body functions by constantly releasing a steady amount of thyroid hormone into the bloodstream. If the body needs more energy in certain situations, for instance, if it is growing or cold or during pregnancy, the thyroid gland produces more hormone. This organ, medical term which we use for it is glandula thyroidea, is found in front of the neck. Thyroid gland is basically present in front of the neck on anterior sides under the voice box. It is a butterfly shape, and the two sides of lobes lies against and around the windpipe trachea, and are connected at the front by a narrow strip of tissue. And the thyroid weighs between 20 to 60 grams on average. It's basically from 20 to 60 gram on average. So it is surrounded by two fibrous capsule. The outer capsule is connected to the white box, muscles, and many important vessels and nerves. There is a loose connective tissue between the inner and the outer capsules, so the thyroid can move and change its position when we swallow. This is the anatomical structure. As we mentioned that thyroid gland is butterfly in shape, so this is the butterfly structure of thyroid gland. And as we know that it is below the larynx and just inferior to the south box. It has two lobes, a right thyroid lobe and left thyroid lobe. So these are the two lobes. The thyroid tissues itself consists of a lot of small individual lobules that are enclosed in thin layers of connective tissue. These lobules contain a great number of small vesicle sacs called follicles, which store thyroid hormone in form of little droplets. These follicles are generally used for the storage of tiny droplets. So these follicle acts as a storage. They can store these materials. Okay, this is the structure that how can the thyroid hormone be formed. So as we know that the anterior pituitary can secrete six type of hormone and the posterior pituitary can produce two kind of hormone which are the posterior hormone include oxytocin and vasopressin which also known as ADH antidiuretic hormone which store posterior pituitary can store for temporary time. After anterior pituitary can secrete six kind of hormone which include LH, FSH, PRL, TSH, ACTH and GH. Now we are going to the mechanism that how can the thyroid hormone released. So this is the anterior pituitary hypothalamus. This is the hypothalamus, and below the hypothalamus is a structure, the master gland, which is known as pituitary. So the TRH factor, hypothalamus can release a factor known as TRH. This TRH acts upon the anterior pituitary. When it acts upon the anterior pituitary, so it stimulates the cells and secrete the factor which is known as TSH, thyroid stimulating hormone. When thyroid stimulating hormone is produced, it gets into the blood and reach the thyroid gland. When it acts upon the thyroid gland, so the thyroid gland can produce different kind of hormone include triiodothyronine and thyroxine. Triiodothyronine is also known as T3 and thyroxine is known as T4. Additionally, thyroid gland can also produce calcitonin. So calcitonin, triiodothyronine, and thyroxine are the three hormones which are produced by the thyroid gland when TSH act upon thyroid gland. Furthermore, this is the general explanation that sensory input, for example, feeding or temperature or lifting, they act upon the hypothalamus. Hypothalamus release a factor which is known as TRH. The TRH acts upon the anterior pituitary when it act upon the anterior pituitary. So the anterior pituitary gland secrete a factor which is known as thyroid stimulating hormone. When thyroid stimulating hormone gets into the blood, it produce act upon the thyroid gland, which produce thyroid hormone, which is calcitonin, thyroid and thyroxine. Okay? So these three kind of hormones, the general mechanism include, for example, this is a T4, this is T3, okay, this is iodine factor, and this is tyrosine factor, okay. So this is the general mechanism. Furthermore, this is this biochemical structure, that how can it be formed. So the thyroxine, which is known as tetraiodothyronine or thyroxine, it include 4 iodine, and the triiodothyronine includes 3 iodine. So that's why it is, this is called tri and this is called tetra. We should not get confused in this structure. This is tetraiodothyronine due to the 4 iodine molecules, and this is tri due to the 3 iodine molecule. Okay? Furthermore, the thyroid hormone regulates the body's metabolic rate, controlling heart, muscles, and digestive functions, brain development, and bone maintenance. So, yeah, its correct function depends on a good supply of iodine from the diet. When there is a good iodine in the diet, so it will work well. Okay. Furthermore, goiter, that what is goiter and how can goiter be produced? So goiter is an enlarged thyroid gland due to any cause is called a goiter. Okay, when the inflammation takes place in the thyroid gland, it produces a goiter. For the gland to be palpable, it must be at least 40 gram, and a patient with goiter may be euthyroid, hyperthyroid, or hypothyroid. Euthyroid is the these are the condition when there is some disorder takes place. Hyperthyroidism is the condition which the thyroid gland produce high amount of hormones, and the hypothyroid is the secretion of less amount of hormones. So this is the general structure you can see in the structure. Okay, this is thyroid gaitor condition. Furthermore, hypothyroidism, this is also called underactive thyroid or low thyroid or hypothyrosis, is a disorder of the endocrine system in which the thyroid gland does not produce enough thyroid hormone. The symptoms of an underactive thyroid include tiredness, being sensitive to cold, weight gain, constipation, depression, low movement and thoughts, muscles aches and weakness, and muscle cramps. And standard treatment for the hypothyroidism involved daily use of the synthetic thyroid hormone, levothyroxine, which is known by leaf tea, and citronide, salicylate, and other. This oral medication restore adequate hormone level, reversing the signs and symptoms of hypothyroidism. And replacement therapy also include creatinism. This is the general disorder includes congenital hypothyroidism, underactivity of the thyroid gland at birth. It can cause creatinism, which results in growth retardations, developmental delay, and other abnormal features. Creatinism can be due to deficiency of iodine in the mother's diet during pregnancy, and hypothyroidism or ectothyroid condition when the thyroid gland produce much more thyroid hormones in its normal level, so it can cause, it occurs when the thyroid gland produce too much of the hormone thyroxine. Okay, hypothyroidism can accelerate body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. Severe treatment are available for hypothyroidism, and the symptoms of overactive or hyperthyroidism condition includes nervousness, anxiety, and irritability, mood swing, difficulty sleeping, persist tiredness and weakness, sensitivity to heat, swelling in the neck from the enlarged thyroid gland goiter, and irregular and are usually fast heart rate, twitching or trembling, grave disease, and another immune system disorder that result in the overproduction of thyroid hormone. Hypothyroidism, although a number of disorders may result in the hypothyroidism producing grave disease. Grave disease is a common cause. Okay. Furthermore, anti-thyroperoxidase antibodies standard treatment for Hashimoto disease is levothyroxine, levothyroxone, and the synthetic form of thyroxine T4. However, extracts are available that certain thyroid hormone derived from the thyroid gland or pegs. These products, thyroid, for example, contain both levothyroxine and triiodothyronine T3A. Furthermore, um, there are some drugs and some substances used to treat such kind of condition. For example, potassium iodide, iodomarin. The most rapid effect at pharmacologic dose of care is the decreased thyroglobulin utilized, thereby decreasing thyroid hormone secretions. The decreased thyroglobulin proteolysis, thereby decreasing thyroid hormone secretion. The resulting slight reduction of T4 and T3 concentration in serum causes transition to increase of thyrotropin TSH concentration in serum. The internal dose of these tablets include 100 to 20 milligram and their half-life is 24 hours. Common side effects of potassium iodide includes allergic reactions, skin rashes such as hair swelling, and various parts of the body such as face, lips, tongue, throat, under hands and feet. Fewer giants pain, trouble breathing and speaking or swallowing, wheezing, or shortness of breath. Okay. Levothyroxine, brand's name is Levoxel, Synthroid, and Unithroid. Levothyroxine oral tablets is used to treat hypothyroidism. It's also used to treat goiter and certain types of thyroid cancer. Levothyroxine comes in three forms: an oral tablet, an oral capsule, and in injectable solution. So it comes in three forms. For example, oral tablets. It can also take as oral capsules and injectable form also. It can be found in injection form also, and the internal dose of these drugs include 25 to 300 milligram, and which have the paternal dose of 100 mcg per milliliter, having a half-life of 6 to 7 days. The most common side effects of levothyroxine can include increased appetite, weight loss, heat sensitivity, excessive sweating, headache, hyperactivity, nervousness, and anxiety. Furthermore, uh, antithyroid agent inhibits the synthesis of thyroxine, T4, and triiodothyronine, which includes metamizole, which is also known as Northex or Tepazole, or propylthiouracil, propylthiouracil, okay, which has the internal dose of 5 milligram or 50 milligram, and having no paternal dose and having the half-life of 5 to 6 and 1 to 2 hours, okay. The mechanism of action of these drugs, uh, methanol and propylthiouracil, inhibits the production of new thyroid hormones in the thyroid gland. It acts by inhibiting the enzyme thyroid peroxidase, which usually function having the function of to convert iodide to iodine molecule, to convert into iodine molecule and incorporate the iodine molecules into amino acid tyrosine. The common side effects of these drugs may include nausea, vomiting, upset stomach, headache, dizziness, drowsiness, numbness, and tinny feeling, rashes, itching, skin discoloration, muscles or joint pain, hair loss, and decrease in sense of taste. Okay? Furthermore, there are some descriptions which include, for example, thyroid stimulating hormone, TSH. It can be used in the different values, and they are free thyroxine FTA4 and total triiodothyronine AGA. They can be used under different conditions. Furthermore, uh, these are the structure. Metamizole tablets can be also used. Next one are more are thyroid tablets GSP. They can be also used. Okay, they have your different description. For example, if you use iodomarin having 200 mcg tablets, they can be only used one tablet per day. Furthermore, methimazole can be used one tablet per day. We have milligram of 10 milligram, 10 milligram a day. So this is all about my presentation. Thank you so much. Thanks for your attention, and thanks for your precious time. This was all the drugs which can affect the thyroid gland. There are some related conditions. So thank you so much for your attention. Goodbye for now. Thank you.